My name is Sue Robotti, and I'm the Executive Director of DES Action USA. And this is the fourth in our continuing series of Facebook Live interviews with people who have been important in the history of DES. Tonight we're going to be interviewing Susan Bell, who is the author of DES Daughters. Is that backwards? That's interesting. DES Daughters, Embodied Knowledge and the Transformation of Women's Health Politics. While this was actually published several years ago in 2009, it's a insightful, meaningful, and impressive book that has it publishes multiple interviews with actual DES daughters, expressing what their process was like in DES, and then it discusses in depth. The entire DES women's health politics, its role in women's health politics. I'm waiting now for Susan Bell to join us. Susan, I hope you're watching. And as you know, Susan, the way Facebook Live works is Susan makes a short comment, just puts hi on the screen, and then I'm going to be able to click and link her in. In the meantime, for those people who are watching because it's Susan Bell and are not aware of exactly what DES is, DES is a drug, diethylstilbestrol, that was invented in the mid-1930s. It is the very first synthetic estrogen. It was given to women in pregnancy and approved by the FDA for women in pregnancy. For those pregnancies that were at risk, where women were at risk of miscarriage. They were given the synthetic estrogen in the mistaken belief that it would help continue the pregnancy. It generally did not help continue the pregnancy, although many babies were born after their mothers were given DES during pregnancy. Those children are called DES sons and daughters, having been bathed in estrogen for 9 months of pregnancy or whatever period of time, had an effect on the developing fetus. And many of the DES sons and daughters had abnormal reproductive organs, and there's a particular cancer, CCA, clear cell CCA cancer. It's a cervical and vaginal cancer, and very rare. I'm waiting for Susan Bell to comment in, and hopefully she'll be here in a second. There were probably 5 million women who were pregnant and given this drug. That happened during the 1940s, 50s, 60s, and the very early 70s. It did happen somewhat after that, but in 1971, the link to CCA cancer and DES exposure in the fetus was, I'm going to touch the screen, was established. Now, Susan Bell is going to be coming on. The magic of Facebook we are doing now. And there is Susan Bell.
Hi.
And I hear you.
Finally.
Yay. My apologies. The Facebook gods were not with us today, but I'm glad you're here now. So
I'm glad I am too.
And you're safe in the storm?
Yes, I haven't been outside.
I did.
But yes, it's a beautiful storm.
Well, I'm in.
Drexel closed today.
Okay. Susan is in Philadelphia and is a professor at Drexel University, and I am in New York City. So we are both experiencing the Eastern storm. Susan, I did not actually prepare a bio on you, and so I'm going to put you on the spot and ask you if you would give people just a 30-second introduction to yourself and your background. I mentioned you're a professor at Drexel, but not of what?
I'm a sociologist, and I study the sociology of health and women, health and illness, women, gender politics. My new research is on care for immigrant and refugee patients in the United States. I was for many years at Bowdoin College in Maine, and I came to Philadelphia 2.5 years ago to head the sociology department, which is a new department at Drexel University. So that's where I am now. And I am the author of DES Daughters, which is a book that we're talking about today.
Yes. I did a very brief intro to it. When I read it, I was particularly interested and struck by the interviews with the DES daughters. That must have been
Mm-hmm.
very meaningful for you. They're very in-depth interviews. They're very personal and very emotional.
Yes.
Did
Um,
Yeah.
Go ahead.
I actually wanted to go right to the title, the subtitle of your book. We'll
Mm-hmm.
hold it up again so people can see it. This My copy is very well worn and has many underlinings in it. But I got stopped right by the subtitle, which is Embodied Knowledge and the Transformation of Women's Health Politics. And it becomes clear in the book what embodied knowledge is. But for those who haven't read the book, I was hoping you could explain that for us.
Mm-hmm. Um, Actually, the work of art that's on the cover kind of shows what embodied knowledge is, and I'll talk about that in a minute. But embodied knowledge refers to the kind of knowledge that comes from experience. And that's not to say that there's something called pure experience, but instead of saying the body is not reliable, the body can mislead us. We need to, in order to really know about the body, we need to remove ourselves from subjectivity, from particularism, and move into a world of ideas and control and hypothesis testing or systematic research that, in fact, the body can be the basis for very important knowledge. And it can point the way forward. And so I'm drawing from some work about embodied health movements, which looks at not only cases like DES, but breast cancer activism or environmental movements where people say something is wrong. And Lois Gibbs is a very famous example of this. She lived at Love
Mm-hmm.
Canal, and there was something going on in the community. There were illnesses that were unexplained, but patterns of them. And it was embodied knowledge, the sense that something is not right. And this is what we're seeing is real, that becomes the basis for then moving forward. And I think a really good example in the case of DES is where Margaret Lee Braun, who's one of the founders of the DES Cancer Network, gave a talk in which she said, you know, anecdotes, we can't rely on anecdotes. We need evidence, but we can't ignore anecdotes either, that we need both of these kinds, both of these ways of knowing. And so my book is filled with embodied knowledge where somebody is saying, well, in DES Action, there are people who say, look, we have noticed immunological disorders. There's nothing about it in the record, in the scientific record, but we think it should be investigated. And in fact, it turns out that there is some relationship between exposure to DES and immunological disorders. And it was the listening to the body and then having scientists listen to the people who listen to their bodies to move forward to develop research.
And that's a wonderful, wonderful point, is that the women with DES exposure and the mothers of the DES daughters actually got a seat at the scientific table and were able to talk
Yeah.
to doctors and guide the doctors as to what to look for. Was that
Yes.
unique at the time? Was that the first time that's happened?
I was thinking about that, you know, because I know you're interested in that. And so I think certainly going back to the link between DES, taking DES in pregnancy, and DES cancer, the idea for that, the hunch, came from one of the early mothers, one of the mothers whose daughter was in that original study.
Mm-hmm.
And that was in the late 1960s, where she said to her doctor, Dr. Felder, could it be the DES? And initially said no. And then he said, but my instinct
Yeah.
led me to think maybe she was right, and she was right. Um, there were, I would say, at the time that DES mothers and daughters started sitting at the table, they pushed their way in, and they weren't alone. There were other women and other activists who at the same time in the 1970s were part of the women's health movement and patients' rights movements. I think DES daughters were actual and mothers, I would say, were in some ways more successful in some ways. So they were part of a government task force in 1978 to look at DES. They were part of a program in 1992, but that was already when there was already a women's health initiative in the government. But I'd say in the 70s, they were finding themselves and placing themselves at a table alongside of some other groups. But
it was the time.
So it was a time. I hesitate. I don't know whether they were the very first, but they were certainly an important example of taking that seat and demanding that seat and getting it.
I interviewed Judith Halfand, the documentarian, Healthy Baby Girl, last month, and I asked her a very similar question. Did DES kind of forge the way for other groups? And she, I think, was a little bit puzzled at my question because I don't think she thought of it in that way. She clearly just was, doing what needed to be done. And I think that's what happens if DES daughters looked around and mothers and knew what had to be done, and so just did that. And I just want to say in this interview, I'm probably going to say DES daughters as if that's the only person affected or type of person affected by DES. The book generally focused on DES daughters, which is why I'm doing that, but DES mothers were very much affected. Their health was not, in addition to their emotional health and relationship with their children.
Assume that I'm still okay. You're back.
Something interrupted my phone.
There you go.
We're back. So they're and now DES grandchildren are showing some effects. So, but today we're really going to be focusing on DES daughters because that's what the book is about. Which leads me to the question: is what made you so interested in the DES daughter population?
I was in the 1970s. At the time I was going to graduate school at Brandeis, I was also working at a women's health center in Cambridge. And it was in the mid 1970s. And so we would always ask, did your mother take DES? And there was very little information about DES at that time. And I was looking for a dissertation topic that was a women's health topic and that was of relevance. And so at that time, I actually couldn't really study DES daughters because there were so many lawsuits that people couldn't talk to me. So I initially started by looking at the development of the drug. And once I'd finished my dissertation, I then turned to the daughters because I kept wanting to know, well, what impact was there on these women? And I'd seen some of them coming through the clinic, but they were, there were women who were coming in for other reasons. And did your mother take DES was one of the questions that we asked at the Women's Health Center. And so it was both my curiosity, my sense that it was a really important women's health issue, and wanting to do something that would be a meaningful topic beyond the academy.
And it was very meaningful to very many people. I'm glad you did that. Thanks. I know you interviewed many different DES women, and their attitudes towards their medical care and their bodies was very different than what we expect or experience today. And many of them seemed, I don't know, they seemed like sheep maybe a little bit, who are being led. I don't want to be disrespectful. The reproductive health was being medicalized, and the attitudes of the medical communities sometimes was very patronizing. and very paternalistic. And it's upsetting today to read how women were not informed about what health decisions were being made about their body, even before surgery in some cases. Um, so today, I'm trying to get to the question here. This is a very long question. Um, so today, patients are generally more proactive. We use the internet to look for doctors, to rate our doctors and research conditions. We even challenge doctors' opinions and their advice. Do you think DES action was a catalyst for this? Do you think the DES action actually changed medicine, the way that we all look at medicine today?
So the question is really, I think, is in a couple of parts. So the first part is women's attitudes then, and just kind of going back to then, if you think about then as being the late 1960s and early 70s, when the connection between cancer was being first discovered, and a number of the women in my study were diagnosed with cancer at that period. And in that period, there was a study done in 1960 of physicians, and 90% of them said they would not tell their patients they had cancer. And of the 10% who would, they'd use euphemisms like tumor. By 1977, the same survey was published in the Journal of the American Medical Association. 97% of them said they'd tell their patients. And so this was a period of, if they had cancer, and this is a period of great change. And yes. That's an enormous change. So in fact, it was normal not to tell your patients, and patients wouldn't ask. It was also the period, in the early period of the DES daughters, was the golden age of medicine. And so doctors knew best. They were assumed to know best. They assumed they did know best. And now things have really changed. And I think DES action and DES daughters were part of that change. The word catalyst suggests they were it. I don't think they were it, but I think that they were a very important group, and in part because of what happened to them. So DES was frequently used as an example alongside the Dalkon shield as an example of iatrogenesis, which is doctor-caused disease or problems. And it was striking. This was young women who were otherwise healthy, who had, their mothers had taken a drug to prevent miscarriage that hadn't worked, and then they got cancer rarely, or they had reproductive tract problems. So there was this really serious problem in young women. And many of the doctors who prescribed DES to their own wives. Most of the physicians were men. So I think DES daughters and mothers and sons and DES Action and the DES Cancer Network were very important parts of this change in medicine and change in patients' rights. And so they work together with other groups and other causes that were similar of changing relations of power and knowledge and getting access to knowledge. So Our Bodies, Ourselves was written, it first published in 1970. And it started, the group that wrote that book started as a, how can we find a better doctor group? And so DES Action was part of a larger women's health movement that was making changes in different particular areas that have had an effect. And I think they have had effect. Certainly I saw it with DES. I saw DES activists making changes alongside of, in many cases, physicians and scientists in how the work was done, in legislation and funding for doing work together.
Which leads me to ask you about the last section of the title of your book,
Hmm.
uh,
Yeah,
Women's Health Politics. So,
yeah.
and if you could talk a little bit about what women's health politics is, because it sounds like you were kind of describing the generation of it, the beginning of women's health politics just now.
Hmm. So I, that the answer to your question is big. And so I'll try to be confined. And in the early part of the 1970s, women's health politics was, I'd say, very oppositional. Walking into a doctor's office or confronting physicians or demanding access to abortion or resisting sterilization abuse,
Mm-hmm.
demanding changes at the FDA and labeling of drugs and medications. And so with DES action and DES activists, what this meant at the time is kind of illustrated by either being the passive patient or the not passive patient. And um, you, I have examples of women who had those different paths. But what I think distinguished DES health politics and why I think it's part of a transformation is ever since the beginning, there were always alliances between DES daughters and either nurse practitioners or physicians or laboratory or clinical scientists. And again, from very early on, they were talking to each other, they were working together. And it wasn't as if they always agreed, and it wasn't as if it was always comfortable, but there was a sense in which they realized a common goal. And I'm wondering, um, I was thinking about it and preparing to talk to you, whether again it was because this DES was a wonder drug. It was a drug that was supposed to be great, and there had been not warning signs all along, even before it was put on the market.
Absolutely.
But
Mm-hmm.
there were physicians like Dr. Herbst, like Dr. Ohlfelder, who were two of the authors of the original paper that linked DES with cancer, with reproductive tract cancer. Um, that they wanted to figure this out, and they wanted not just to figure it out, but to do the right thing and to to try to move ahead, because this was an unprecedented kind of disease. Um, but women's health politics also involves not just changing relationships between women and doctors, but ways of knowing and ways of doing science. And DES activists have been very much part of creating the research questions, um, helping to recruit subjects, um, being part of the the development of the research programs and the legislative strategies. And they've been leaders, but they've also been collaborators. And so one of the chapters in my book is called Undoing Science as Usual. And I think that, the transformation of women's health politics is in part the undoing of the normal ways of doing science in order to do science better. And in order to do science that is going to have outcomes that are healthy outcomes or that are just outcomes, and that it takes a long time. It takes funding, and it takes risks. And so there were risks in what the DES daughters did. And I know this example better than I know any other example. Um, and I know that there are other examples of undoing science as usual.
Mm-hmm.
But this is, I think, a really wonderful example of how women's health politics can transform science and how DES transformed women's health politics.
I'm a DES daughter, not surprisingly. And I know that I personally have always had resentment to the doctor who gave DES to my mother, and had anger at the doctors who gave DES to the mothers. But as I go through these series of interviews this year and learn about DES with much more depth than I've ever had, I begin to realize that doctors really are not my enemy. And particularly in the case of DES, there are so many good doctors who really helped really helped DES daughters to try to get some control over their health and to try to get some answers. And so without the doctors' willing participation, the answers that we've gotten so far with DES could never have happened. And the daughter's transformation from passive patients to being much more actively involved in their own health couldn't have happened. I'm struck by the statistic you mentioned earlier, and I can't remember the time span it was, but the
16 years, 61 to 77.
yes, and it's a tiny piece of time for anything to happen in medicine, and for doctors' attitudes to change so completely from should a patient be told that they have cancer to of course a patient has to be told if they have cancer. Reminds me that the medical community does change and is getting better all the time, I suppose. But now that I've made this personal, I'll ask another personal question. I noticed that many of the women that you interviewed in your book emphasize their general good health outside of the DES damages. There are several women who said, I'm very, very healthy, except for the fact that I had cervical cancer, which is kind of humorous if you think of it that way. But I do that myself. When people ask about, what were your damages from DES, I'll, explain that it caused me to be infertile because of the deformities in the organs before I was born. But other than that, I'm a really very healthy person. It didn't seem to, knock on wood, have any other damages for me. And is that just I guess is that typical of DES daughters? It's kind of a denial thing I think I have going on.
Right. It's not something I've actually thought about and until you asked your question. And I wasn't, and I'm not entire. So one way to understand that is the women that I interviewed were between the ages of 21 and 40, and 10 of them had DES related cancer and 10 of them had not. And so these are young women, and they, and some of them had serious illnesses, including cancer, as young women. And in some ways, it reminds me of the men who developed AIDS, who were healthy and in the prime of their life, and then they were healthy until they weren't. And the DES daughters were healthy until they weren't. But the way you're asking the question is not just about the diagnosis of something, but how you think of yourself. And there's a lot of, I don't think of it as something striking. And it may be because there's, if you think of living with DES as living with some kind of chronic condition, whether or not it's a serious or a not serious condition, somewhere along the continuum, that there are certainly in the living with illness and disability communities, people will talk in much the same way that you are. I'm healthy, except, and there's a wonderful film called Rolling that was made by a physician, researcher, filmmaker, and 3 people who use wheelchairs, in which basically they're fine, except they use wheelchairs. And they're not all fine, but they present themselves as, this is how I live. And they have different conditions that led them into the wheelchair.
I guess, yeah.
So I don't, I don't, I, it wasn't something that stood out for me um, as something that I noticed. And so I could go back and think about it, and it's an interesting question, um, you know, that you saw that among them, because I didn't see them as sick. I saw them as uh, living their lives, and in one way or another, having dealt with a variety and along this continuum of from very serious reproductive tract cancer to um, maybe worry about having children someday and not really knowing
Um,
whether they were going to have trouble.
right. Karen Kalishman is our member manager, and so actually answers the 800 telephone line for DES Action, and she wanted me to ask you, um, and I'll just read her question the way she phrased it. One of our most primitive desires is to reproduce, yet this was stolen from DES exposed individuals, and I should emphasize not all DES exposed individuals,
Right,
but
right, right,
but
yeah.
to too many. However, today there are many different ways to have children, and not every person wants to reproduce or to be a parent, which you touch on in your book. If this DES tragedy happened today, do you think that DES exposure would have played out differently in the women's movement and healthcare activism and scientific and biomedical practices?
Yeah. So I think that with regard to parenting and becoming a mother, there's still a very strong dominant discourse of um, becoming a mother biologically,
Mhm.
becoming a mother through pregnancy, and that the discourse of or the story of I want to get pregnant, I get pregnant, and I have a baby is still the dominant one. And there are more and more options, and there's more variety with new reproductive, not so new reproductive technologies. Um, so I think in terms of whether DES would have an impact similarly with regard to people's ideas about becoming mothers, I don't know. I don't know whether it would be different today. We have the example of Zika, the Zika virus, and the Zika virus is passed both sexually and by mosquitoes. And the kind of attention that's been drawn to the effects of it is reminiscent of DES. You know, the women who are exposed to Zika during pregnancy have a high percentage of risk of giving birth to a child with very serious neurological disorders. And um, and it's no longer a global health emergency. It was declared one by the World Health Organization.
Mhm.
But women have gone to extreme measures to protect their pregnancy and to protect the safety of upcoming pregnancies that remind me of DES. That said, the other part of the question is, well, what kind of impact, would it be different in the women's movement and science and medicine? And yes, because even the example of Zika is not just about the United States and the West. It's about globally, and it's more about the global South and South America and Latin America than it is about the United States. And that's an indication of the transformation of social movements, which are global. Um, the the world in which we live is not the same world in which we were living in the 1970s, 80s, and 90s. And the kind of politics, the health politics, the science are very different. So taking the example of Zika, there were groups of scientists, in multidisciplinary groups of scientists that started working together and using, social media and conferences to start doing studies immediately about Zika and folding it into research they were already doing. And so it was kind of a global effort. Social media, the internet, big science has made a huge impact on how science is done and the communication that scientists do. In terms of what else? What were the other sectors there? There's science.
Well, I do like how you're pointing out how responsive medicine has been to the Zika virus issue. And it's lovely. It would be lovely to think that if there's a DES exposure similar issue today, that it would be as it. So she had said, would it play out differently in the women's movement, the healthcare activism, scientific and biomedical practices? It's hard to know. If things were different, things would be different.
Yeah, right. And I think we're also seeing how government can change on a dime. And so even getting funds to the CDC for Zika under the Obama administration was a real effort. And then there was a lot of debate about whether it should be taken from somewhere else to put to the CDC towards Zika or something else. And then funding strategies and policies have changed dramatically with a change in presidency. And the same with reproductive politics and abortion. So we do see the importance of national and international governance and policy and funding today, as we did in the case of DES, where it was very important to get legislation passed to fund long-term research for DES. So that remains. The ability for science, the scientific community, and the medical community to respond is definitely positively affected by communication systems. But and the women's movement is much more diffuse today than it was in the 70s when DES action started. So that it seems like there are kind of two questions there. One about the push to reproduce and have children, and the other about the politics. And I'm not sure whether Karen had some sense of wanting to see the two connected, or if she sees them connected.
Well, Karen, make a comment so I can read it, because I know she's watching.
I'm not sure I answered her question.
No, but your answer was interesting, whether it answered the question or not. It's been 9 years since your book was published. In that time, what are you working on now? And did your work on DES inform your next steps, what you worked on afterwards?
One of the things in that the DES work did was the daughters, the women that I was interviewing, showed me and kind of pulled me into recognizing the importance of not only narratives, which the book is about stories and narratives and changing narratives, but also of visual representations and art. And so one of the directions that I've gone is to look at visual narratives and how people make sense of their experiences, of illness experiences, or more recently of dislocation and migration, by making art or using art as a way of making sense. So that's one direction that's come out of DES, but doesn't necessarily on the surface look like it's connected to DES, although people like Judith Helfand were very influential in my own thinking and my own work. The other thing I have been working on is a project on pharmaceuticals and what I call pharmaceuticalization. That is turning what it is that, what processes are in play to turn problems into ones that must be solved by pharmaceuticals. And DES could be seen as an example of that, of solving a problem of pregnancies at risk with a medication as opposed to something else. And the medication went wrong. So I've done some work on, more work on pharmaceuticals, but in a more abstract sense than I did with my earlier work on DES and DES daughters. And then the other big project I'm working on is a study of hospital outpatient care for refugee and immigrant patients. And that's not very connected to the DES work, except I'm taking the on the ground interactional time in the clinics, in the waiting rooms, in the team areas, in the exam rooms, to look at how it is that across language differences, doctors and patients and nurses and patients talk to each other about health problems and health solutions.
Well, your book really is all about communication, about speaking up,
Yes,
speaking out, being heard, finding people who want to hear your story and people whose story you want to hear, how the DES daughter is connected. It's really amazing in a time long before there was internet that these women, made the effort to find each other and to get together and to keep in touch and communication. I'm going to give one more plug to your book, DES Daughters,
thank you.
Embodying Knowledge. I know it's you can still get it on Amazon, I'm happy to say.
Yeah.
What I found very powerful about it, for anyone who hasn't read it, is that it's filled with narratives and stories, to pick up your phrase. I have never read a sociological study in this way. It's a while it seems to be a fairly academic book, it's very accessible, particularly throughout the narratives. And I was fascinated to hear these women's stories about their health process through DES. So for any DES daughters or sons or mothers or grandchildren who are watching, I would strongly recommend it. Uh, Despite the fact that it's, these the stories were about what happened to women in the 70s and 80s. It's very resonant now to anybody who's a DES daughter. Are there other audiences for this book? Do you find that there are other people who want to read it?
Yes. It's read in medical sociology courses. It's read by students who are learning about the health system, about medicine, healthcare, illness. And it's also, as I understand it, read in communities where people are interested in endocrine disruptors and the environment. So because DES is the first endocrine disruptor, it's not a real estrogen, but it acts like an estrogen, and it disrupts the development of estrogenic systems of the reproductive tract, and it has long-term effects that show up later. And so it's also an example of that, and read in that community, although that's not the central point of the book.
I'm going to ask you a very tough
So,
question now, because I feel
yeah.
like we're wrapping up. Is there a central lesson to be learned from DES, from the perspective of what you wrote in your book?
Um, I would say there are maybe two or three lessons.
Uh-huh.
One is prudence and the precautionary principle, which is something that has been adopted in environmental sciences, that DES is really a warning about being cautious and prudent as opposed to looking for quick answers, both in its effect on the pregnancies, on the mothers and the daughters and the sons, but also I think in the importance of long-term struggle and long-term change, that it shows that hanging in there over a long period of time and being willing to work in creative new ways and search for answers in ways that haven't been tried yet, and trusting experience and trusting different forms of knowledge can have a very big and beneficial outcome in the long term, but it may not be apparent immediately. And I think what I find so impressive about it is the people who've hung in there for many, many years, whether it's Judith Helfand, who was just on this,
Yeah.
on the live Facebook with
Uh-huh.
you, or John McLaughlin, who is at the National, I think it's the Environmental Health Institute, and he worked with Pat Cody and people very, very early in the 70s and was instrumental in supporting the daughters and mothers coming up to the table. Or Louise Slaughter, who just
Yeah.
died a week ago, who was a champion of DES and DES action, and was one of the people who was instrumental in getting the legislation passed. So those people show the importance of the long haul for making change, but also the potential benefits of doing that and of thinking creatively and differently and working across lines. So and the one other thing the big point I make in my book is, in the course of trying to do the best they can to live with a lifelong condition with ups and downs, and that has at times very, very serious negative consequences for one's health. The DES daughters have made changes not only in their own lives, but have become part of this feminist health movement. And so there is a relationship between people's actions on their own behalf and their ability to make social change if they're working with other people. So I think it's a hopeful lesson at a time we need hope.
We do. Thank you. Thank you for all your wisdom today, and for your book, and good luck on your future work. Thank you, everybody
Thank
who's
you.
watched today. I would like to say that on April 18th, we'll have our next Facebook Live, and we'll be speaking with Michael London, who is an attorney, has been for many years with DES cases. Sadly, he has a couple of active DES cases in the court system now, and he's worked many years on that. So that'll be at 7 p.m. on April 18th. And thank you again, Susan Bell.
Thank you, Sue.
Bye-bye.
Bye-bye.